I'm Melanie Palm from Art of Skin MD in Solana Beach, California, and today we're going to talk about hand rejuvenation. I often tell patients that we take really good care of our face, but sometimes it's our neck, chest, and especially our hands that actually give away our age. So things that happen to our hands over time is that we start to lose some of the soft tissue support there. So we start to lose some of the lovely fat that helps keep our backs of the hands really supple. And so there are simple ways that we can give a little bit of that volume back so that we don't notice some of the prominent veins that happen over time, and to give a little bit of soft tissue support back. Now there are various things that we can use in order to do that. Some of my three favorites are a product called Radiesse, which is calcium hydroxyl apatite. Second product, which we're going to demonstrate today, is Perlane, can be used, and that's somewhat similar to Restylane. It's in that same family of products which are called hyaluronic acid fillers. The third one is fat, so we can actually take our own fat from various areas, a little bit from the knee or the inner thigh, and actually be able to transplant it back into the hands and rejuvenate the hands in that fashion. So what I'm going to demonstrate today not only is just putting a little bit of that product in the back of the hands, but also using a more innovative technique called cannulas. So cannulas are blunt-shaped needles, so they don't actually hurt. And one of the reasons we use this in places like the hands or when we're doing fillers in the face is it decreases the amount of trauma, and as a result it decreases swelling, and more importantly it decreases bruising associated with different procedures. So in order to insert the cannula, we first have to make a little poke. So I've got a little introductory needle that we're going to focus just at one entry point. So I've actually put a pinch of numbing medicine in there, so our patient shouldn't notice this at all. And I'm going to put that little needle in there, and as you can see, the patient is really comfy. And as you can see, it just sort of sits there. And now that I know where it is, we're going to take our actual cannula, so that blunt-shaped flexible needle, and we're going to insert it through that little hole. And actually thread it through the different areas that we want to revolumize. So as you can see, this is really comfortable for the patient. And we're just going to do a little bit of threading. And my needle is right there. I'm going to put a little bit of volume there. And then I'm going to come over this way. I'm going to put a little bit into this area. There's also some numbing that's actually in the Perlane, or if we use Radiesse, in the Radiesse itself. And then we're going to thread our way over this way and catch this area. And as you can see, I can sort of sneak in there, get around the different tendons and the little vessels without disturbing them. Come back here, we're going to put our last little bit in there. So once we're actually done putting some of the filler in there, so we're done with this end, I'm going to lightly massage that area. So we put threads in between those areas where she's lost some volume. And now we're going to just massage a little bit. So there was a little bit of numbing that was in the filler itself, so that increases comfort after the procedure. I usually don't do more than one syringe of any single product at a sitting, because I find that if you're able to do that, there's minimal trauma to the patient. There's very little swelling to the back of the hand. If you use more product, I find that recovery is a little bit longer. And I'm always looking at finding ways that patients can get right back to their daily activities. So as you can see, really easy to do, no trauma to the back of the hand. We have nice filling in that area, and you can't even see where we entered. And so that's the basics of doing a little bit of hand rejuvenation in a few minutes. Thanks for joining us, and we hope to see you again soon at Art of Skin MD.